In this video, I will inform you about the Zollinger Ellison syndrome, based, as always, only on scientific data ascertained by the most experts in the field. What is Zollinger Ellison syndrome and what are the treatments? Hi, I'm Dr. Manu, and this channel is all about health and wellness. I help you by providing certified scientific information in a simple and cohesive way. Now, let's dive right in. Zollinger Ellison syndrome is a rare condition in which one or more tumors form in your pancreas or the upper part of your small intestine, the duodenum. These tumors, called gastrinomas, secrete large amounts of the hormone gastrin, which causes your stomach to produce too much acid. The excess acid then leads to peptic ulcers, which are open sores that develop on the inside lining of your stomach and the upper portion of your small intestine. What are the symptoms of Zollinger Ellison syndrome? Signs and symptoms may include abdominal pain, diarrhea, burning, aching, gnawing, or discomfort in your upper abdomen, acid reflux and heartburn, burping, nausea and vomiting, bleeding in your digestive tract, unintended weight loss, and decreased appetite. If you have a persistent, burning, aching, or gnawing pain in your upper abdomen, especially if you've also been experiencing nausea, vomiting, and diarrhea, inform your doctor about it. Also keep in mind that if you've used over-the-counter acid-reducing medications such as omeprazole, cimetidine, or famotidine for long periods of time, these medications may mask your symptoms, which could delay your diagnosis. What are the causes of Zollinger Ellison syndrome? If you do a quick Google search, it turns out that the major generic medicine sites, written for the masses, attribute an unknown cause to this condition. It seems that modern Western medicine acts in watertight compartments and is almost always incapable of forming meaningful multidisciplinary connections. As we have said, it all starts with the formation of one or more cancers in the pancreas or duodenum. Well, the risk factors for these are clear and well documented. Probably still other further causes have to be discovered, but the link with those already observed is solid. The risk factors are smoking, obesity, familiar genetic predisposition, diabetes, a diet that contains meat, fish, eggs, dairy, and trans fats, inactivity or lack of exercise, alcohol abuse, Helicobacter pylori infection, and chronic pancreatitis. Going into the specific about the genetic predisposition, if you are subject to the condition called multiple endocrine neoplasia type 1, or if you have a blood relative in the family with this condition, you are 25% more likely to develop the disease. As you can see, most of these factors listed above are controllable and are lifestyle dependent. The scientific studies and meta-analysis listed in the description regarding the risk factors listed are just a few examples. I cannot go into this video to explain every single risk factor presented due to lack of time and not make this video 3 hours long. In Zollinger Ellison syndrome, during and after the formation of cancers, the production of digestive juices by the duodenum or by the pancreas is altered. This is because these cancer cells release large amounts of the hormone gastrin. Increased gastrin makes the stomach produce far too much acid. The excess acid then leads to peptic ulcers and sometimes to diarrhea. In the advanced stages of the disease, the cancer can form metastases which can affect the lymph nodes or the liver. Treatments of Zollinger Ellison syndrome. The treatments are divided into 3 parts: clinical ones aimed at cancer, pharmacological ones aimed at excess acid, and non-clinical supportive ones. Clinical ones aimed at cancer often involve consideration by doctors about the possibility of removing the cancer surgically. An operation to remove the tumors that occur in Zollinger Ellison requires a skilled surgeon because the tumors are often small and difficult to locate. If you have just one tumor, your doctor may be able to remove it surgically, but surgery may not be an option if you have multiple tumors or tumors that have spread to your liver. On the other hand, even if you have multiple tumors, your doctor still may recommend removing a single large tumor. In some cases, doctors advise other treatments to control tumor growth, including removing as much of a liver tumor as possible, i.e. debulking, attempting to destroy the tumor by cutting off the blood supply, i.e. embolization, or by using heat to destroy cancer cells, i.e. radiofrequency ablation, injecting drugs into the tumor to relieve cancer symptoms, using chemotherapy to try to slow tumor growth, having a liver transplant. Pharmacological ones aimed at excess acid include the use of proton pump inhibitors, drugs that reduce acid by blocking the action that produces it within acid-secreting cells. Commonly prescribed medications include lansoprazole, omeprazole, pantoprazole, raprazole, and esomeprazole. Long-term use of proton pump inhibitors has been associated with an increased risk of reduced intestinal absorption of vitamins and minerals, kidney damage, dementia, and a greater risk of bone fractures, especially if you are 50 or older. However, if you suffer from Zollinger Ellison syndrome, the use of these drugs in conjunction with cancer reduction or elimination methods is essential to increase life expectancy. These therapies are not optional. Either malignant pancreatic or duodenal cancer or peptic ulcers resulting from excess acidity can be fatal if not treated in time. Non-clinical supportive ones. The integrative method of improving prognosis and increasing life expectancy and well-being includes adopting a healthy lifestyle. The aggression and rate of growth of cancer is strongly influenced by the food you eat, the quality and quantity of sleep, the ability to manage psychological stress, lack of adequate physical activity, and exposure to agents such as smog, smoking, and drinking alcohol. Diets containing trans fats, cholesterol, pro-inflammatory agents, heavily processed and non-whole foods, and a high amount of saturated fat reduce life expectancy in patients with established disease. Yes, exactly. Not only in cancer patients, but in every single chronic pathology recognized and studied. If you don't believe me, listen to this example. In an accredited scientific study of 477,202 people in 10 countries, the carcinogenic effect of eating chicken meat was found to be further confirmed. A 72% increased risk of pancreatic cancer for every 50 grams of poultry consumption. That's just like a quarter of a chicken breast. Before going into the clinical aspects of the disease, I mentioned lifestyle as a preventive and protective measure. It should therefore not be surprising if the same measures that reduce the risk of contracting a disease are also those that reduce aggression and potential fatality of that same pathology. In order not to make this video too long, I will discuss better only the two factors that are least considered by the population in general regarding cancer, which are diet and sleep. One of the fundamental mechanisms by which these lifestyle components affect cancer is the counterbalance of oxidative stress, free radicals, and toxins taken in, implemented through the antioxidants, the fibers, and the phytonutrients that adequate foods contain. Another mechanism is the healing and regenerating power of sleep. Experts recommend 8 hours of sleep per day. Poor sleep or low-quality sleep plays an important role in predisposing a person to cardiovascular disease, diabetes, dementia, obesity, depression, cancer, kidney disease, and others. Almost everyone knows that physical activity, managing stress better, quitting smoking, and quitting alcohol help fight cancer, so I won't go into that now. Supplements that can help. Various scientific researches regarding the anti-cancer and anti-inflammatory power of various natural compounds have been carried out over the years. For now, the single compound that has been proven to be the most effective in fighting cancer, and specifically pancreatic and duodenal cancer, is curcumin, an active ingredient contained in turmeric. A common obstacle in the treatment of pancreatic cancer is drug resistance. Curcumin can help to overcome the resistance to chemotherapy. Moreover, researchers found that curcumin blocks the formation of spheroids in cell cultures, which suggests that it would also inhibit the growth and recurrence of tumors. Plus, turmeric and its curcumin compound have proven useful in so many other health problems. Being anti-inflammatory, it reduces the symptoms of autoimmune diseases such as lupus, multiple sclerosis, rheumatoid arthritis, and psoriasis. Helps to combat diseases of the circulatory system by reducing the absorption of LDL cholesterol, the bad one, and triglycerides. May help regulate body fat by helping fat metabolism. Can improve blood sugar metabolism and potentially reduce the effects of diabetes on your body. It is protective against chronic liver damage by helping reduce harmful oxidative stress. It is also antifungal and antibacterial, helping to fight infections. Unfortunately, the curcumin in turmeric is poorly absorbed into the bloodstream. As a result, you could be missing out on its advantages to health. However, adding piperine, a black pepper compound, can help enormously. Research supports that combining the piperine in black pepper with the curcumin in turmeric enhances curcumin absorption by up to 2,000%. This combination is so powerful that some studies have shown it to match the power of some anti-inflammatory drugs without the negative side effects. Incredibly, despite the potency, the authorities have not recognized a maximum intake limit, given the good tolerability and safety of the compounds. However, it is important to respect the dosage recommendations on the supplement packaging, because in some cases, symptoms of nausea and headache have been reported in high dosages. In conclusion, whether you want to prevent Zollinger Ellison syndrome or treat it, given the severity of the condition, it is imperative to discuss any type of treatment with your doctor. If in addition to clinical therapies, lifestyle recommendations are also followed, the possibility of protection, healing, and well-being will greatly increase. If you like this video, don't forget to like, subscribe, and hit the notification bell to stay up to date on new content. Thanks for watching.